Do you sometimes feel a small bump or swelling on your arm after a doctor gives you a test? That could be part of something called the tuberculin Mantoux reaction. It's not a disease itself, but more like your body's way of saying, hey, I've seen this bug before. This reaction is linked to tuberculosis TB, a serious lung infection. The Mantoux test is used to check if someone has been exposed to TB bacteria. When the doctor injects a tiny amount of TB protein under your skin, and you've been exposed before, your immune system reacts. That's the type 4 reaction, a delayed but smart defense move. Think of it like your body's security system recognizing a past intruder and showing proof with a little red bump. What causes this skin bump in the Mantoux test? It's your own immune system at work. The test uses a harmless protein called tuberculin taken from dead tuberculosis bacteria. If you've ever been infected with TB, even if you didn't feel sick, some special white blood cells, called T cells, remember it. When they see the tuberculin again in the test, they rush to the spot and cause inflammation. That's the red raised bump you see 48 to 72 hours later. It's like your body sending immune soldiers to investigate a familiar suspect. But no live bacteria are used, so you can't get TB from the test. It only shows if your body has met TB before. Have you ever watched how your body reacts to a mosquito bite? At first, nothing. Then hours later, it becomes red and itchy. The Mantoux reaction is similar, but without the itch. After the test, nothing happens for a day. Then, a red, firm bump appears at the injection site. You don't feel tired, feverish, or unwell. The only symptom is that bump. Its size matters. Larger bumps mean higher chance of TB exposure. For example, if the bump is over 10 millimeters wide in someone with no risk, it's a red flag. But if you live with someone who had TB, even a 5 millimeter bump might be serious. There's no pain or pus, just a silent message from your immune system. So what happens after the bump shows up? Diagnosis starts by measuring the bump with a ruler, not the redness, but the hard raised part. A nurse checks it 2 to 3 days after the test. If it's big enough, doctors may order a chest X-ray or sputum test to see if TB is active. But here's the twist: the Mantoux test doesn't treat anything. It only tells if you've been exposed. If you're healthy but exposed, you might take medicine like isoniazid for months to prevent future TB. No antibiotics are needed if you've never been exposed. False positives can happen if you had the BCG vaccine, so doctors consider your full history. It's like solving a mystery with clues. The bump is just one piece. Can we stop this reaction, or better, stop TB exposure? Yes, the BCG vaccine given in many countries trains your immune system to fight TB. But it can cause a positive Mantoux test confusing things. The best prevention is avoiding close contact with people who have active TB, especially in crowded or poorly ventilated places. Imagine sharing a small room with someone who coughs a lot. That's risky. Healthcare workers often get tested yearly. If caught early, latent TB can be treated before it spreads. Prevention isn't just a test, it's clean air, masks, early treatment, and staying informed. Think of it like wearing a seatbelt: small step, big protection. Are scientists still improving TB testing? Yes, the Mantoux test is old, over 100 years. Today, blood tests like IgRA, interferon gamma release assays, are faster and not affected by the BCG vaccine. They check how your blood cells react to TB proteins. These tests are more accurate for people vaccinated with BCG. Also, researchers are working on breath tests or skin patches that could detect TB without needles. Imagine blowing into a device instead of getting a shot. Some studies even look at AI to read test results from photos. Science is moving from weight and measure to quick and smart. The goal: faster, painless, and foolproof TB detection